Welcome to this latest session of the ELSI Dialogues webinar. My name is Monica Cano Abadia, Senior Scientist at BBMRI ERIC, and I will be moderating this session. This ELSI Dialogues webinar is today organized in collaboration with the BBMRI ERIC Academy and the European project Evolve BBMRI. Today, we are going to explore the role of biobanks in realizing the One Health approach, which aims at sustainably balancing and optimizing the health of humans, animals, plants, and the environment. This integrated perspective is crucial for global health. Nonetheless, it operates within regulatory frameworks that differ across sectors. So today, in this webinar, we will be exploring the complexity of this topic. Next slide, please. Briefly, some background a bit about BBMRI ERIC before we start. BBMRI ERIC stands for the Biobanking and Biomolecular Resources Research Infrastructure, and it has the scope to facilitate access to sample and data collections across Europe to advance biomedical research for the benefit of European citizens. To reach this goal, BBMRI ERIC relies on a network of national nodes in the member countries, as well as a team of interdisciplinary experts from medicine, social science, ethics, law, IT, quality management, patient communities, and industry partners, with shared values of facilitated access to progress in healthcare and disease prevention. In 2013, BBMRI ERIC was set up as a distributed research infrastructure, and it is one of the largest research infrastructures for health research in Europe. Next slide, please. As regards of ELSI services and research, our department, we provide support on ethical, legal, and societal issues, ELSI issues, and we operate on the basis of a federated model in partnership with a network of experts from many different fields across both our national node and project partners, alongside three key cornerstones: research, service, and training. Next slide, please. I want to welcome today's experts. This webinar will open with a short introduction by Josephine Uldry from Swiss Biobanking, outlining the means for the biobanking community to support One Health approach in research. Then we will have a presentation by Professor Jakob Zinsstag from Swiss Tropical and Public Health Institute, who is a pioneer on the One Health concept and will share insights from his extensive field experience in implementing this approach in diverse contexts and communities. And then we will have another presentation by Dr. Adam Strobeyko from Swiss Biobanking and Global Health Center Geneva Graduate Institute, who will discuss the legal dimensions of pandemic prevention, preparedness, and response, and the efforts to integrate One Health into international frameworks and practical implications for biobanks. Welcome to the webinar, everyone. Thank you for your time and expertise on this important topic. And without further ado, I welcome Josephine Uldry as our first speaker.
So hello, everybody. I'm happy to be here today to talk about the role of biobanks in realizing the One Health approach. It will be short. My idea is really to give you a few hints on what we could do as a biobanking community to foster a One Health approach in research. I was thinking about how to introduce the One Health concept to you biobankers, and I know that for many of you, One Health sounds like a non-human topic only. I actually think it is more of a human health topic with a plus, because it takes into consideration a broader context of what health truly means. And if I don't convince you, I'm pretty sure that Jakob and Adam will definitely afterwards. At the international level, One Health is framed and guided by the OLEP, the One Health High-Level Expert Panel, that was initiated by a quadripartite made of the WHO, the FAO, which is the Food and Agricultural Organization, the UNEP, which is the UN Environment Programme, and the WOA, which is the World Organization for Animal Health. And so these OLEP define One Health as an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. So One Health is about promoting a sustainable, a healthy future for humans, for animals, for ecosystem, by the collaboration between sectors and discipline, the coordination of different communities inside the societies, and through the communication and capacity building. Jakob will come back again to all this concept afterwards with more details. This quadripartite also proposed a joint action plan to implement the One Health approach at the international level, with 6 action tracks to follow, with themes such as combating zoonotic diseases, combating antimicrobial resistance, increasing food safety, and many others. And I also proposed 3 so-called pathways to change to implement this approach that focus on first governance and financing, so schematically, implementation readiness, and finally on strengthening data and evidence. And this is for this specific pathway that scientific research, biobanking, is useful because it can create this evidence to support policy making. So as you've understood, One Health is a broad topic and many different scientific biobanking projects can be described in a One Health framework. I will just give you some examples. Infectious diseases biobanks, when the purpose is to track emerging diseases across different species. Environmental biobanks, when we want to monitor the pollution and the changes in the ecosystems. Veterinary biobanks, when we want to study zoonosis or antimicrobial resistance. Also human population biobanks, when we want to do a link between health data and exposure to pesticides, to pollutants. Also food and agriculture biobank, when the purpose is to improve safety and study the resilience of crops, of livestock. And finally, even natural history collections, if you want to assess the impact of the changes in the environment on biodiversity on a long-term basis, for example, 100 years, these kind of collections could be used. I also wanted to give you an illustrative example of how biobanking can be useful in One Health research, and I chose to talk about Rift Valley fever. Rift Valley fever is a zoonotic disease that spreads from a certain species of mosquitoes to livestock, and humans usually get contaminated by direct contact with animals. And so usually these are heavy rains that tend to trigger an outbreak by increasing the population of mosquitoes. And so as for many diseases, we tend to notice the disease when it happens in humans. So when there is an outbreak in humans, which is represented in pink if you see my scheme, not mine, but this beautiful scheme. But actually before there is the outbreak in humans, there are many different events that led to this outbreak, like an outbreak in cattle in yellow, and before that, the cases in mosquitoes. And so some scientists thought, oh, but what if we could measure some parameters before all that happened so that we're able to predict the outbreak? And so to do that, biobanking is useful because in this case, they needed some integrated analysis of environmental data, serological data from humans, from cattle, and so they could predict the risk of an outbreak to come in different regions in Africa. So a very useful cases of how biobanking can be used in this kind of research. And so when you have access to the measure of this kind of parameters, you can then also put in place some public health measures, such as vaccinating the cattle in an epidemic period that would lead to that would prevent an outbreak in humans from happening. So now if we try to think for all of us biobankers in our very heterogeneous community, how working at the interface between human and non-human fields, how it impacts the practical aspects of biobanking. So in very practical terms, it means collecting a wide variety of samples from human, microorganism, animal, from soil, from water, from plants, from a wide variety of sources such as hospital, veterinary clinics, nature, and also collecting a wide variety of data. And then we transport all this material to one single biobank if you're lucky to have thought about including a One Health approach from the beginning, and if we had the financial resources to do so. But most of the time, these are different biobanks that were created in different contexts and that are managed by different personnel that have different expertise. And so they got the samples for different reasons, from different sources. And so in the end, 5 years after that, we have researchers who would like to work on a One Health project. And so they would need, if possible, standardized information on all the pre-analytical steps related to the sample. So for example, the precise timings of the collection, the precise location of the collection, but also some medical information from the participants, so health-related data. So of course, it leads to many challenges for the biobanks, and I just try to list some of them. First one is just the access and sharing of diverse samples and data. You will understand with Jakob's presentation and his projects that only this is a challenge in itself. The second one is the specific study design in the One Health research. So when I talked to Jakob, he told me, oh, but you know, when you got some samples 10 years ago, it's not that you can easily use them for a new kind of research. You need very specific study design. Sometimes you just don't have the right data so that you're able to produce some quality research. So this is also something that we need to discuss. Is it possible to provide the right data, to collect the right data with the samples in our biobanks? And finally, last but not least, as it's an ELSI dialogue, of course, when you work with different samples collected in different contexts from different sources, there is a high chance that you will have some ethics and legal issue at some point, and it will be illustrated by Adam's presentation afterwards. So now, if we want to advance One Health biobanking, what we should do is first stay close to the real needs on the ground. We need to talk to researchers as Jakob and as many others to understand the needs related to the samples and also related to the associated data. We need to build trust with quick wins with the non-human community and then expand step by step. So for example, include the first non-human biobanks in our networks, gain a bit of expertise on our side, and then expand to others biobanks. And this is something that is done in the frame of Biberi-Eric roadmap, specifically strategic objective 1.3 that is co-led by Austria and Norway. We need to transfer the knowledge also that we've gained in the human fields related to quality, interoperability. I really think that we've learned a lot of knowledge on how to, for example, make a community use the same standard, how to make this community use the same procedure. This is something that we could also make the non-human community benefit from. We also need to strengthen partnership with other expert hubs and European infrastructures. There are already many great things that are done in the One Health field and also non-human field. And I think we could definitely position biobanking by developing some collaborations with these initiatives. And this is something that is done in the frame of SO 1.1 that is led by Biberi-Eric headquarters, and 1.2 that is co-led by Italy and Switzerland. And so, of course, our final aim would be to leverage our network to encourage synergies across human and non-human fields. We have a network of maybe 95% of human samples. I think if we can increase the commitment of non-human biobanks, we could be able to provide the research community with very interesting samples and associated data. So this is it. Thank you for listening to me, and I'm looking forward to listening to Jakob and Adam. You can find my contact information if you want to talk to me, if you have questions or ideas. And also thank you, Monica, because I know that it's your last day. It was really a pleasure to work with you this past year.
Thank you very much, Josephine. Now we are going to listen to Jakob.
Welcome to this webinar. I'm very pleased to introduce you to the potential of One Health, but I would like to embed it into the philosophical, ethical, academic and political transformation it entails. You see here our website of the Swiss Tropical and Public Health Institute, my email address, and also a web reportage, One Health story on the work of our research group. For those of you who don't know Swiss TPH, we are in a new building in Allschwil. We are altogether over 1,000 staff today. This is an old slide. We are active in 120 countries, and we have about 90 nations in our institute. So we are quite a global player, and almost a shadow ministry because we are larger than SDC or the Federal Office of Public Health. But we are really globally engaged, and One Health is part of it. I talk to you today from Hanoi, where I attend a conference on the future of livestock production in Asia. This is of utmost importance because livestock and wildlife are associated to the origin of the COVID pandemic. So we really have to discuss this from a One Health perspective. I will briefly also relate to the different integrated concepts like eco-health and planetary health, and but will concentrate then on One Health, on the One Health definition by the One Health high-level expert panel, of which I'm also a member, and also discuss the latest methodologies. We can propose today a game theory of One Health, which is a mathematical economic framework that actually allows to address these complex questions. And I will end with issues on the operationalization of One Health. So as Josephine mentioned already at the beginning, the point of departure is really this definition of sustainably balancing and optimizing the health of humans, animals, plants, and ecosystems. This has, if we think it through, a lot of philosophical and ethical consequences, and we have to ask the question, how can we really address such a complex issue? So we want to study the interaction of humans, animals, wild and domestic, plants, wild and domestic, environment, naturally and built. Not all issues, not all problems touch all four realms, but many of them do. So altogether we need an urgent paradigm shift because we have to move away from a purely anthropocentric point of view. Because if we concentrate only on the human and ignore the environment, we are about to destroy our planet, and we have to nurture it actually. And we are quite in line with Corinne Peluchon, a philosopher in France, who actually suggests a new enlightenment that goes away from anthropocentrism and dualism towards thinking of humans in their environment. So we have a transformation of the ontology from a human-centered perspective to humans in their environment. She also expands on hope versus optimism. She proposes an approach of consideration and of vulnerability. I don't have time to go in more details, but we are quite in line with these new philosophical streams. One Health is fundamentally about cooperation, and I show you here a picture of my wife because she actually put that book on my table, which inspired me actually to develop a One Health game theoretical approach based on this book by Novak and Coakley, The Principle of Cooperation. A very important part of One Health is also its transdisciplinary approach. Transdisciplinarity means that we engage with non-academic actors as research partners. Here on the left side, you see a stakeholder meeting in Ulaanbaatar on echinococcosis. And on the right side, you see a stakeholder meeting under a tent 100 kilometers north of Timbuktu in North Mali in 2006. But the principles are always the same. We bring together decision makers, the concerned population, and the scientists. We really listen to the people. We ask what are their problems. And any participation and also sharing of samples for biobanks depends on the willingness of the communities to participate, but also of the authorities to allow it. You see the website transdisciplinarity.ch, which is the website of the Swiss Academies of Science Transdisciplinary Network. Switzerland is world leading in these approaches, bringing together science and society. We actually co-produce new transformational knowledge from practical perspective or from practical knowledge and theoretical academic knowledge. So transdisciplinary is an orthogonal, can be considered like an orthogonal vector on the plane of interdisciplinary collaboration that we also need, but it is really most of the time bringing different epistemologies together, different ways of knowledge generation. On this slide, I can also show you briefly what we mean with the other integrated approaches. Actually, eco-health interlinks public health, animal health, and the environment, but it is really One Health that postulates an incremental benefit, an added value, or also tries to optimize these interactions. Planetary health is the youngest of these approaches and essentially interlinks human health and the environmental change at planetary scale. So coming back to the OLAP definition of sustainably balancing and optimizing the health of humans, animals, plants, and ecosystem, I want to ask you, how would you do that? How would you actually attempt to develop a system of these four compartments? Our point of departure is the tragedy of the commons proposed by Garrett Hardin. Garrett Hardin said that if there is a common pool resources, it is inevitably overused and depleted in the absence of external control. So if we have a fish pond, we all go fishing until there is no fish anymore. Or if we have a pasture, we all put our sheep on it and let them graze until there is no grass anymore. This is the tragedy of the commons, and we have several of these tragedies of the commons at planetary scale at the moment. One of them is the loss of biodiversity. We are at the point of losing 1 million species of plants and animals of about 8 million. And if we destroy our ecosystems, we also will not be able to survive. Other tragedies of the commons is the climate change. We all fly around like hell, including me, and we think the others should save carbon emissions. But we all have to come back and save more to really achieve the Paris climate targets. Another tragedy of the commons, which is more related to biobanks, is antimicrobial resistance. Antimicrobial resistance kills today more people than the cumulative loss of all infectious disease. So how to overcome these tragedies of the commons? And there we revert to Elinor Ostrom. Elinor Ostrom was a resource economist and political scientist, and she said, yes, the tragedies of the commons are a reality, but that's not the end of the story. In the world, there are thousands of communities that manage their natural resources in a sustainable way since hundreds of years. And she wrote this book, Governing the Commons, for which she got the Nobel Prize in 2009 as the first woman economist. In the book of Elinor Ostrom are examples, and the first example in her book is the mountain village of Törbel. The community of Törbel manages its natural resources, its forests, meadows and water resources in a sustainable way since over 700 years with a written text. So the principle is self-restraint. The people of Törbel stabilize their own community, but also every farmer could only bring as many animals on the mountain pasture as he could feed through the winter. And by this self-restraint, they could manage their scarce resources. This is particularly touching to me because I'm born and raised here in Visp, as you see, and my father had a house in Törgl. So for me, this example of Elinor Ostrom was really an eye-opener. Elinor Ostrom proposes the concept of a social ecological system. This is a qualitative, quantitative framework of management of natural resources, both at the level of resource systems, which are pastures, land, water, and forests, the resource units, which can be logs, animals, fruits, vegetables, everything we harvest, the governance systems at different levels, from the nation to the community, and the actors, of course, all of us. And it is the actors that decide on focal action situations, which lead to interactions and outcomes on the sustainable use of these resources. We have expanded this social ecological system by including humans as a resource. What does that mean? We all earn an income which contributes to our nation's wealth. This is our per capita contribution to the gross domestic product. But if we fall ill or if we die, this contribution, the per capita contribution, is reduced or lost. We call this also the human capital benefit. So now we have a formal mathematical economical framework that allows us to simulate health of humans, animals, plants, and the environment. You see it in a very broad schematic in the center of this figure. We also scaled the actors from the household up to the nation and to international cooperation, and the same for the governance systems, from national conventions to the constitution, to unwritten rules or other texts. The first example that validated this concept with a game theoretical approach was actually the question how to eliminate rabies in Africa. Dog rabies is mostly caused by the bite of animal bite, and you have several strategies to act on that. The first strategy is to do post-exposure prophylaxis on humans. This saves the life of the people, but it will not interrupt transmission because transmission is ongoing between animals. If we intervene by coordinated mass vaccination of dogs, we can interrupt transmission, and at the end we save over $10 billion over 30 years, calculated over the whole continent of Africa, compared to human post-exposure prophylaxis, which is the red curve here. The cumulative cost of dog mass vaccination is only about $800 million. What does coordination mean? Coordination means that if South Africa starts vaccinating, it will coordinate with Namibia, Botswana, Zimbabwe, and Mozambique, and eventually the disease will not come back. A plan for the Pan-African elimination of rabies has been adopted by the African Union in February, and we are currently planning on the operationalization. This is not an utopia because Africa was able to eliminate rinderpest in 2011 very much in the same way. But this here is not a pure benefit cost analysis. This is actually a game theoretical strategy analysis, which means that we look for Nash equilibria. At the end, it means that all actors can adhere to a dominant strategy because nobody will lose out. This is the purpose of a game theoretical approach. This can be very much applied also to non-communicable diseases or chemical contamination, like here the PFAS problem. This is a publication on Australia, but done by Swiss colleague Jasmin Hufschmid, who is a professor in Melbourne. And this schematic shows that PFAS are basically everywhere in the environment, in the wild animals, in the domestic animals, and in the humans. And I think we have very much the same problem in Switzerland. It can also be applied to antimicrobial resistance surveillance. This is the flow chart of the distribution and spread presumed of antimicrobial resistance that we need to understand to find out what are the best strategies to prevent the creation and the development of antimicrobial resistance. And this example shows you also why it is so important that we expand human biobanking to biobanking samples basically from everything that is of importance to answer questions about the distribution and spread of antimicrobial resistance. Our experience was it is just a lack of willingness that prevents us from doing it. For example, in Kyrgyzstan, we collected human Brucella strains and, livestock Brucella strains, and we wanted to ask the human authorities, public health authorities, to share their strains, and they bluntly refused. There was no willingness to share strains. Or in Morocco, we collected bovine TB strains from abattoirs and wanted to compare them with M. bovis strains from the hospital in Rabat. And again, the authorities just refused. So if there is no political willingness to cooperate, we cannot do joint biobanking. So we need at least this willingness. The next issue is that of integrated surveillance response systems. The World Bank already proposed in 2012 this schematic, meaning that if you discover an emerging disease in the environment or in mosquitoes, the related costs, this is the red line, are relatively low. But if the disease gets into livestock, the costs are also already rising. And if it gets into public health, the costs are exploding. There is no better example than the COVID pandemic to validate this example. So we have already such existing integrated surveillance systems in Europe, for example. In Emilia-Romagna, West Nile virus surveillance is done for mosquitoes, wild birds, horses, and humans. And the different sectors communicate what they find. And in this way, they can prevent, for example, that contaminated blood is given to human patients, and they save already millions of euros. So at the moment, in the world, most surveillance response systems are still separated. Human surveillance is governed by the international health regulations. Animal health is governed by the World Organization of Animal Health performance of veterinary services system. So what we propose is that we create a One Health governance mechanism that establishes the communication of the different sectors, including the collection of samples from all species. So by introducing a One Health governance, we can maybe not prevent the next pandemic, but we can significantly reduce exposure and delay the outbreak in other species, and in this way massively reduce the cumulative cost. This is the future of pandemic prevention worldwide, and every country should develop genuine integrated surveillance response systems. But infectious disease and non-communicable disease is not the end of the story. We have microbiota in our intestines, in our skin, in our soils, and also on plants, and of course in animals. And including the microbiota is even getting a big step forward and will involve biobanking heavily. But that's music of the future. At the moment, the European Union is considering the operationalization of One Health, I was co-chairing this working group, writing the evidence review report on how to integrate One Health into the existing governance. Many laws in the European Union and also in Switzerland are already laid out for One Health. They just need to be expanded. And we need to develop new legal provisions that actually allow sharing of streams and sharing of information. It is a philosophical question of what do we give more importance? Is it personal privacy or is it the societal benefit of reduced antimicrobial resistance or freedom of disease? You see here a list of policies in the European Union, and all the green parts here are actually already highly integrated, including human, animal, agriculture, environment, climate, economic, and institutional aspects. This report is freely available. Many countries have already started to create One Health platforms. Interestingly, in Europe, Switzerland is the only country that has already a decree that asks our federal offices of public health, food safety and veterinary affairs, agriculture and environment to work together on specific domains like integrated surveillance, antimicrobial resistance, and pandemic prevention. Interestingly, it is also many developing countries have already functional One Health formal platforms. I'm the editor-in-chief of Kabi One Health, where we try to publish studies that demonstrate the incremental benefit of this closer cooperation of human health, animal health, plant health, and the environment. And we welcome your future contributions. Thank you very much for your attention.
Thank you very much, Jakob, for this very stimulating presentation. And now let's hear from Adam.
Hello, everyone. I'm Adam Strobeyko. I'm an ELSI officer at Swiss Biobanking and a legal advisor and researcher at the Geneva Graduate Institute. And today I'm going to be speaking to you about the legal dimensions of One Health and the implications it has for biobanks. So the agenda for today is I'm going to start by speaking about some of the legal concept theories that could allow us to go beyond anthropocentrism in our regulation and the legal world. Then I'm going to briefly describe the policy context of One Health, highlighting how it developed around major public health crisis. Provide you with an update of international negotiations that may be relevant for One Health, speak about the national legal systems and how they implement international rules, and finally, some of the very practical best practices for biobanks. So Jakob has already done an excellent job with Josephine defining One Health. It is one of the approaches that allows us to see this integration between the human, animal, environmental factors. But it is not a legal approach per se. It is not a legal provision that I will talk a bit about how it is fragmented across legal regimes internationally. And Jakob has already mentioned some of the harmonization efforts. Other approaches that can be of help is that of research commons that Jakob has already presented as well. So moving from state sovereignty to some form of commons governance. And finally, there is new streams of literature that try to recognize the rights of microbial life or the rights to the fruits of microbial life. This is a very new stream of scholarship, as Jakob mentioned, probably a song of the future. But I mentioned these and I put the sources in the footnotes together with colleagues. We are publishing a paper on this rights to microbes and rights of microbes approach. But for today, let's focus on the conceptual development of One Health. So if you see from this timeline, the major developments around the concept of One Health in policy circles and in international law have appeared around some of the major crises, such as SARS, H5N1, and COVID-19. And in a recent paper that I wrote together with my colleague Daniela Moric, we analyzed One Health and came in policy and international law circles and came to conclusion that it is best understood as a recognition of an invitation to cross-sectoral cooperation rather than a concrete legal obligation. Again, that's from the legal perspective. COVID-19 definitely catalyzed conceptual integration. We see it with the establishment of the quadripartite, its definition, and the joint plan of action that previous speakers have mentioned. And however, the absence of a single dedicated international venue or concrete obligations foster fragmentation across human, animal, and environmental health regimes. So in a recent paper with my colleague, we analyzed 55 instruments across the quadripartite international organizations, so FAO, WHO, WA, and UNEP, and the Convention on Biodiversity. And this analysis has revealed that there's no single unified legal regime for One Health, rather a constellation of soft and informal international instruments. So it was mostly the resolutions, strategies, joint plans, guidelines, and reporting tools that drive coordination. There is a lot of cross-referencing between different governing bodies of these organizations, and also efforts at aligning reporting and strategies, for example, on AMR. That is seen in the establishment of the quadripartite joint secretariat on AMR. However, this approach, driven mostly by soft law instruments, not legally binding instruments, has some limitations, and these include the conflicting mandates. So each of these international organizations tries to define One Health in a way that aligns with its mandate, and as a result, instruments are driven mostly by institutional agendas rather than common good. There's questions of accountability. So much of this is about informal instruments or soft law instruments adopted by, for example, governing bodies or international organizations, that these forms of instruments tend to bypass ratification and democratic scrutiny. And there are questions about how they affect power asymmetries and what kind of actors they privilege. So that's about One Health, kind of more of a survey of One Health and different international instruments. Now, let me provide you with some of the updates of what's actually happening in international law. So we mentioned international health regulations, the IHR. The IHR are the main existing normative framework for global health, and its core capacities include preparedness in terms of surveillance, laboratory capacity, and risk communication, which are all relevant from One Health perspective. And the IHRs include tools such as joint external evaluation, where you would have experts coming to a country and evaluate core capacity under IHR. There you would have the handbook for the assessment of IHR capacities at the human-animal interface, and the WHO benchmarks, which include benchmarks on antimicrobial resistance, zoonotic disease, food safety, national lab systems, biosafety and biosecurity, and surveillance. However, these tools are voluntary and their adoption varies by countries and regions. And historically, the IHR have focused on containment of human health emergencies. The recent amendments in 2024 included some language on prevention, but historically, IHR was mostly focused on human health. Here are the materials I mentioned that may be of interest to you, especially if you work on the biosafety side of things. You can, if the slides could be circulated, you will be able to find them online easily. But now I wanted to speak to you about a different regime. So, oops, I may have lost my slides, but let me speak to you about the Convention on Biological Diversity. The Convention on Biological Diversity has 196 parties and recognizes sovereignty of states over genetic resources, where access to such resources is determined bilaterally, subject to prior informed consent and mutually agreed terms. And benefits could include technology transfer, scientific collaborations, participation in biotechnological research. Convention on Biological Diversity applies only to physical genetic material, not formally to digital sequence information, about which I will speak soon. The Nagoya Protocol to this convention has been adopted to clarify benefit sharing obligations under the CBD and its enforcement regarding the genetic resources, and it provides a more detailed list of monetary and non-monetary benefits. Access fees, licensing, milestone payments, joint IP ownership, royalties over commercialization that can be included in bilateral negotiations of access to genetic resource. However, Nagoya Protocol and its domestic implementation have been criticized for high transaction costs, for failing to generate sufficient benefit sharing, and for neglecting specific needs of human and animal health. Again, these instruments mostly deal with biodiversity. More so, the Nagoya Protocol does not formally apply to pathogen DSI, and also we could make an argument that bilateral negotiations of pick and mat would be ill-suited to the scale of data flows. Now, let me update you with the decision of the CBD Conference of the Parties 16.2, which established a multilateral mechanism for benefit sharing from the use of digital sequence information. It is a decision of the Conference of the Parties. It is not a legally binding instrument, but it invites companies who use DSI across different sectors to contribute 1% of profits or 0.1% of revenue to the Kali fund established for that purpose. And public databases and academic institutions are exempt from monetary contributions. However, they are to inform users of DSI of the relevant ABS commitments and ensure metadata and country of origin disclosure. So there's some language on what the databases are meant to do. Now, again, this is a non-binding COP decision, and it relies on the willingness of the industry and academic sectors. There are also some challenges, such as stacking of obligations. There are different, already you can see that there are different instruments with different obligations between WHO, CBD, bilateral agreements on access and benefit sharing, and national laws, about which I will speak shortly. So far, there has been also little uptake of this multilateral mechanism for the sharing of benefits arising from digital sequence information. So we can maybe see it more as a new beginning for the discussion rather than a final word on how digital sequence information could be regulated. Now, this overview can lead us to some observations about the challenges that biobanks may face. So especially on the intersection between human and non-human. There are silos between human and non-human biobanks in terms of compliance. And generally, we observe low awareness about the rules on the access and benefit sharing side, the rules applicable to non-human material. So many genetic resource users are unaware of the rules applicable to genetic resources, and they risk fines and perhaps more importantly for academic audience, the retraction of articles and reputational damage. There's also an uneven national implementation of Nagoya Protocol. There are recent reviews suggest more than 100 national ABS laws, which vary widely in scope. And the procedures for getting prior informed consent and mutually agreed terms are quite burdensome. They rely on case-by-case bilateral negotiations. This leads us to conclude kind of that there are risks of barriers to cross-border collaboration, which can result in siloed biobanks with incompatible compliance standards that would hinder multi-site exchange and research, can result in penalties for individual researchers, but also limit equitable benefit sharing with provider countries, since we have this low awareness of the rules and problems with compliance. Now, let me present you quickly what is currently being negotiated. And by currently, I mean literally this week in the building next by in the WHO. Pandemic agreement is the first treaty to enshrine One Health article, One Health provision in Article 5. It also has an Article 4 on pandemic prevention and surveillance capacities and national plans to that end. And Article 5 that I mentioned speaks about national One Health policies and strategies to be adopted. And promotes establishment of joint training and continuing education on the topic. And one of the most contentious issue that is currently being negotiated, so the pandemic agreement itself has been adopted, but its entry into force and opening for signature is dependent on negotiation of pathogen access and benefit sharing system. And why this system is so contentious and important? It's because it seeks to provide multilateral access to pathogens with pandemic potential. We don't know yet whether these will be to which extent this will be zoonotic pathogens and how the pathogens with pandemic potential will exactly be defined. And in return for access to these pathogens, participating manufacturers in the system will sign contracts and provide some benefits, including 20% of real-time production, 10% donated, and 10% affordable prices. And it will apply both to material and sequence information. The benefits are yet to be determined and are being currently negotiated. So the pandemic agreement will really depend on the agreement on this annex that deals with access to materials, data, and the sharing of benefits resulting from it. Pandemic agreement will also include conference of the parties, which could potentially be a new focal point for development of One Health, since it is the only international treaty with One Health provision. Now, why has One Health been contentious in pandemic agreement discussions? One Health provisions, so the ones that I mentioned, the Article 4 and 5, have been progressively diluted. There's a lot of caveats, as appropriate, taking into account national circumstances and subject to the availability of resources, that have been inserted because One Health was seen as a security-oriented concept. So basically for the global north to outsource surveillance to the global south. Now, of course, this is oversimplification of long negotiations, but we cannot deny that the concept has carried baggage in the international negotiations. So that's why we observed more of a shift toward national policies, capacity building, and legal constraints in the language of Articles 4 and 5. There are also general questions about how to actually operationalize One Health. It seems like a very broad concept. How do you actually deal with it as a biobank or as a researcher or industry? And there is a question of mandates. So again, disagreement over whether IHR already covered prevention, different organizations dealing with different aspects of One Health, and collaboration between different instruments needs clarification. So actually the PAP system, so the system of access and benefit sharing to genetic material and sequence information may thus turn out to be the most relevant part of the treaty from the One Health perspective once it is established. And why is it relevant perhaps for your work as well? Because it includes provisions on a network of laboratories that would need to meet certain biosafety and biosecurity standards, retain unique persistent identifiers for materials and data, and notify WHO of transfer thereof. And also it would have recognition of certain sequence databases and their policies the databases would have to ensure transparent governance, free access, and some tracking requirements of country of origin and interoperability. Commercial users would have to enter into contracts, as I mentioned, and non-commercial users must engage some scientists from originating country of the material or data and promote co-authorship and notify WHO if shifting to commercial use. And there should be no IP restrictions on PAP's material sequence information. Now, all of this again is really in the course of being negotiated. It may change drastically, but I'm kind of just anticipating some of the topics. These are some of the core discussions and most contentious on which, while the final text may change, these really form the core of the conceptual core of the annex to the pandemic agreement. So now let's kind of move away from this international side and look at how IBS was implemented nationally. And I will provide also the example of digital sequence information in national laws. So firstly, let's have a look at the review of national laws applicable to access and benefit sharing. Then the review of Ljungqvist et al., that is where you see the source in the footnote. You can see a mapping of different ABS laws applicable worldwide in per country. So I wanted to bring your attention to specific points on these maps. First, have a look at the national jurisdiction where access is restricted and benefit sharing is mandated in this light purple, let's say. So you can see an increasing number of countries restricting access to material and mandating benefit sharing. The unrestricted access is comparatively rather rare when you look at the map. Then in the second row, you can see also that how do the countries deal with the infringements of access restrictions or benefit sharing obligations? Well, a growing number of jurisdictions imposes fines, even criminalization and further access restrictions. So the blue and the kind of velvety color on the map. And finally, I wanted to point you to their findings about DSI regulation. A growing number of countries is including DSI in their, so the sequence information in their national legal systems. So imposing restrictions on access to sequence information. Now, there was also an expert study for the Convention on Biological Diversity that categorized these national legislations into 4 categories. So some countries would require bilateral negotiations for access to data. So basically saying that the sovereignty applies not only to access to physical material, but also to sequence information. Other countries would prefer to regulate it through permits and monitoring, which could also include 2-track systems where you would have strict control for foreign access and maybe lighter registration, maybe lighter approach for domestic reasons. Another category is that some countries expect oblige users to share benefits upon commercialization. So once you commercialize, you have to share the benefits. And finally, there's a category of countries that do not impose restrictions on access to DSI. They align with open access models to promote unrestricted sharing and scientific R&D. And my kind of modest contribution to this was to read some of the 14 legislations that apply to, you can see in the box here, that apply to DSI, and how they use definitional techniques, so including DSI, including derivatives, intangible components, to extend the scope of application of their national legal provisions beyond what is agreed in Nagoya to cover more and more aspects and include sequence information in their national legislation. Now, how is it dealt with at the Swiss level? Swiss level has the Nagoya Ordinance, and Nagoya Ordinance, to give you an example, it applies to genetic resources, so material accessed after 2014 from Nagoya party with ABS legislation. And human genetic resources are excluded, so it only applies to non-human materials. The competent authority would be Federal Office for the Environment, FOEN, which issues some guidance, notification, compliance checks. And basically, you have to do your due diligence. So you go to a country, you check its national legislation, you have to get pick and mud from the country, if applicable, and record and pass it on. So this kind of information you have to keep for the records, retain these records, and pass documentation to downstream users. There is also an additional requirement. If you pursue market authorization, you have to notify the Federal Office of the Environment. And if you do not, you could risk fines. Now, So what are some of the best practices to deal with this complexity of international legal rules around access and benefit sharing? Definitely, you would want to check provenance before depositing samples and always check national legislation. If a material comes from Nagoya Party with ABS law, you would need to obtain and store prior informed consent and mutually agreed terms in the documentation and pass it on to the downstream users. What can help when defining the study and when accessing material, what can really help is defining the purpose very clearly. So depending on the jurisdiction, mere taxonomy research may not fall under utilization, while other forms of research, such as study, modification of genetic material, may well fall under these requirements, and it will really depend on jurisdiction and but being clear about what you're doing with it may be helpful. You should not assume that sequence information is free from restrictions. Increasing number of jurisdictions do not see it this way. So you will want to see at least the country of origin and relevant domestic laws in the projects. And when you have doubts, you can contact national Nagoya focal points when clarification is needed. And as best practice, when in doubt, assume that Nagoya protocol will apply. And here are some of the resources you can use. From the Swiss perspective, we have, of course, the FON that I mentioned previously. That's the competent authority. Internationally, there is ABS Clearinghouse, which hosts some of the legislation on ABS. The problem is that sometimes it's not up to date, so you have to double check when you go there. It also has information on focal points and internationally recognized certificates of compliance. Swiss Academy of Sciences provides step-by-step ABS compliance guidance for Swiss researchers and a toolbox to draft mutually agreed term clauses for non-commercial research. German Nagoya Hub is an excellent example of an initiative helping scientists understand ABS obligations. And then here in Switzerland, for example, the legal department of universities work on trying to provide checklists for scientists, for researchers, knowing when to start to worry about ABS laws applying to the research when they work with non-human samples. And the checklist that would simplify compliance for them and streamline the workload associated with it. However, the gap is that the awareness remains low and that dedicated training, institutional compliance officers, and sustained outreach are needed. So this was, thank you very much. This was more of an overview of different levels of laws that apply, and I'm also happy to answer any questions that arise in Q&A. Thank you very much.
Thank you, Adam, for your wonderful contribution, and thank you so much to all these excellent speakers. I would also like to remind everyone that we regularly share updates on the BBMRI ERIC newsletter. You can sign up on our website, which is bbmri-eric.eu, and you will also find the ELSI knowledge base with all our webinars on that website. Watch out for our next webinars and podcast episodes via our BBMRI ERIC socials on Blue Sky and LinkedIn. Thank you for attending.